According to the book, The Thyroid Epidemic by Dr. Michael L. Johnson, over 25 million people have been diagnosed with a thyroid problem, and up to 15 to 20 million people are not aware that they have this problem. Dr. Michael Johnson states in his book that it's very likely that many people are currently undiagnosed. Unfortunately, many people are not aware of the serious role that the thyroid plays in our overall health. The thyroid gland is located in the neck. When the thyroid gland's levels are in extreme low or high, the chances of you having a thyroid, the chances are you may have a thyroid, an abnormal thyroid. There are two different types of thyroid disorder. One is hyperthyroidism and the other is hypothyroidism. Fatigue, anxiety, depression, and weight gain are just some of the symptoms that defines what thyroidism is. And an abnormal thyroid affects the body in ways that you may not see or feel physically, but it affects your body internally. To begin, many wonder what a thyroid is and what causes its abnormalities. According to the National Thyroid Institute, the main function of the thyroid gland is to produce, store, and emit thyroid hormones. There are two types of thyroid hormones. One is the thyroxine and the other one is the triiodothyronine. The thyroid gland is located in the front of the neck. The gland uses iodine to produce two thyroid hormones. These hormones help regulate the body's metabolism and affects processes such as growth and important body functions. Since it is undiagnosed for many around the world, it is encouraged people to go out and get their thyroid levels checked. A few symptoms of an irregular thyroid gland are fatigue, rapid heart rate, weight loss, and irregular menstrual flow that occurs in women. If you have at least two of these symptoms, there is a possibility that you may have an irregular thyroid gland. It is important to catch it early because there is a risk of thyroid cancer or developing a goiter. A goiter is developed when the thyroid gland is enlarged to the point where it is visible. Now that you know a little more about what an abnormal thyroid is, I can now inform you on the two different types of thyroidism that people are diagnosed with. The first type of thyroidism is called hypothyroidism. Hypothyroidism is where the thyroid levels are low and the gland is considered underactive. Typically, with an underactive thyroid, a person will gain excessive weight because the hormones are not keeping the metabolism balanced. Another type of thyroidism is called hyperthyroidism. Unlike hyperthyroidism is when the thyroid gland is overactive. People with an overactive thyroid gland tend to lose excessive weight. Dr. Michael L. Johnson stated in the Thyroid Epidemic that 90% of people who have hypothyroidism have something called an autoimmune thyroid. An autoimmune thyroid is when the immune system attacks the thyroid, which means that the thyroid is like an alien to the immune system. People with an autoimmune thyroid tend to be immune to the medication that regulates it. This causes people's thyroid not to stay at a constant level. Another term for the autoimmune thyroid is called Hashimoto's thyroiditis. To personalize this experience, my twin sister has hyperthyroidism and my grandmother has hypothyroidism. Recently, my doctor told me that I need to see an endocrinologist, which is a thyroid specialist, because my thyroid levels were too high. My doctor was concerned that I had Hashimoto's thyroiditis, which is the one where the immune system attacks your thyroid. She told me that it would explain my excessive weight gain in a short amount of time. Lastly, the thyroid gland affects the body in a way that you cannot feel or see physically, but affects the body internally in its functions. As stated previously, some common symptoms are fatigue, anxiety, depression, weight gain or loss, insomnia, and the inability for a woman to conceive children in some cases. This gland controls your metabolism, hormone, and mood. The gland is controlled by the pituitary gland, which controls hormones and is located in the brain. The pituitary is regulated in part by the thyroid via a feedback effect from the thyroid hormone and by another gland called the hypothalamus. If not enough of the hormones are formed, then it decreases the production of thyroid hormone. The thyroid also controls the mood in more ways than you think. Aggressives can form from this gland in extreme mood swings. According to medicine.net, women with extreme PMS disorder tend to have an irregular thyroid. Fatigue and insomnia are results from not enough production in the thyroid gland. When the thyroid remains untreated for a certain amount of time, you can develop thyroid cancer. According to medicine.net, Thyroid cancer is 3 times more common in women than it is in men. There are 4 types of thyroid cancers: papillary, follicular, medullary, and anaplastic. The cause of thyroid cancer still remains unknown, but certain factors such as a goiter, high levels of radiation, and certain hereditary symptoms are huge risk factors. Most common symptoms of possible thyroid cancer are a lump in the neck, trouble swallowing, and neck pain. Treatment for this is radiation therapy, chemotherapy, and radioactive iodine treatment. In conclusion, over 25 million people have been diagnosed with one of the 2 forms of thyroidism. It is important that it is also apparent that up to 15 million people could have it and be undiagnosed. The thyroid plays a major role to our health. Hyperthyroidism and hypothyroidism are the 2 different types of thyroid disease. A common symptom is weight gain or loss excessively in a short period of time. The thyroid disease should not go untreated for too long. A goiter can be formed in the neck, and thyroid cancer can be developed. Thyroid disease is more serious than the world knows it is. It is important to regularly get your thyroid levels checked. And I have some. This is where the thyroid level is located, and it kind of gives you an idea of what it looks like. And this is what the thyroid gets swollen in the neck, and you can form a goiter, which is visible through the skin. I personally know what this looks like because my sister formed one because she went too long without knowing she had this disorder.